Imagine sitting in a doctor's office. The lights are bright. Your knee has been aching for months. The doctor turns the screen toward you, points at the grainy image, and says four words: bone, on, bone. In that single moment, something inside you changes. The pain that was already there now has a label, a story, a sentence. But what if those four words are wrong? What if the scan you just paid for, the scan you just believed, is one of the most misleading pieces of information in modern medicine? Welcome to the Wellness Bridge. I'm Gary Chen, physiotherapist and founder of GC Integrative Physiotherapy and Wellness on the Gold Coast. Today is Myth Busting Day. We're taking on what I think is the single most damaging idea I see walk into my clinic: the belief that an MRI is the truth about your body. By the end of this episode, you're going to look at your scan report differently. And maybe, just maybe, you'll stop moving again. Let me tell you what I see week after week. Someone walks into my treatment room. They've had knee pain for 6 months or back pain for a year. They're scared they're not moving the way they used to. And they hand me a piece of paper from a radiologist that uses words like severe degeneration, chronic disc bulge, cartilage loss, bone on bone. And I watch what those words have done to them. They've stopped walking the dog. They've canceled a hiking trip. They sit more. They've quietly told themselves a story. My body is broken. The damage is done. Movement will only make it worse. And here's what's heartbreaking. Most of the time, that story is not just unhelpful. It's not even true. I had a patient last year, Gold Coast retiree, mid-60s, lifelong walker, got a knee MRI for some pain after a long beach hike. The report came back with words like severe tricompartmental osteoarthritic change. She read it, went home and stopped walking. Just stopped. 3 months later, she'd gained 8 kilos. Her sleep was worse, her mood was worse, and her knee, surprise, was more painful, not less. The scan didn't damage her knee. The scan damaged her behavior, and the behavior damaged her knee. So today we're going to do something a little uncomfortable. We're going to look at what the science actually says about MRI findings. And you might be surprised by how much of what you've been told is at best half a truth, and at worst a story that's making your pain worse. Let's start with the spine. In 2015, a researcher named Brzezinski and his team published a systematic review in the American Journal of Neuroradiology. They looked at over 3,000 people who had no back pain. None, zero, nothing, and put them through MRI scanners. Want to know what they found? At age 20, 37% of pain-free people already showed this degeneration. By age 50, it's 80%. By age 80, it's 96%. Read that again. 96% of completely pain-free, comfortable walking, dancing, gardening 80-year-olds had what your radiologist would call degeneration. These bulges, 30% at age 20, 84% at age 80. Facet joint changes, 4% at 20, 83% at 80. This is not damage, this is aging. This is gray hair on the inside of your spine. Nobody panics about gray hair, but put the same biology on an MRI and we panic. Now the knee. Same picture. In 2008, England and colleagues published a study in the New England Journal of Medicine, one of the most respected medical journals on earth. They scanned almost 1,000 middle-aged and older adults. 61% of the people they found meniscal tears in had no pain, no aching, no stiffness in the previous months. But here's the line that should change how you think about your knee forever. Among people who already had what's called radiographic osteoarthritis, what your doctor might call bone on bone, 63% of those with pain had a meniscal tear, and of those with no pain at all, 60%, statistically the same, tears in painful knees, tears in pain-free knees, almost identical. The scan cannot tell you which knee will hurt and which knee will be fine. A 2018 meta-analysis in the British Journal of Sports Medicine by Colvino and colleagues pulled over 5,000 pain-free adult knees from 63 studies. In adults over 40, 43% had cartilage defects, 19% had meniscal tears, 18% had bone marrow lesions, and they were fine. They were running, walking, swimming, living. So when someone says your scan shows damage, the honest evidence-based response is, well, half the people walking past us in the supermarket today have the same picture, and they don't even know it. Here is where Western imaging meets Eastern wisdom, and is one of the most profound bridges in modern health. Western medicine is brilliant at one thing: looking at structure. The MRI is a frozen photograph. It tells you what your tissues look like at one moment in time. It is a still life of the body. But pain is not a still life. Pain is a movie. Pain is a living, breathing, moment by moment conversation between your tissues, your nervous system, your stress level, your sleep, your beliefs, and your environment. In a 2021 randomized trial published in the European Spine Journal, Roger Sekaran and his team did something fascinating. They gave one group of back pain patients their MRI report written in standard medical language, full of words like degeneration and protrusion. The other group got the same MRI findings but explained with reassurance and clinical context. After 6 weeks, the group who got the scary words had more catastrophizing, less pain improvement, and worse function. The words on the page made the body feel worse. That's not psychology being soft. That's the nervous system listening to language. The brain reads degeneration and the muscles guard. The brain reads you're okay, this is normal, and the muscles release. In Tai Chi, we have a saying: the body teaches what the eye cannot see. A scan can show you a still bone. It cannot show you breath. It cannot show you balance. It cannot show you the way a body moves through space when it is calm and unafraid. In a landmark 2016 trial in the Annals of Internal Medicine, Wang and colleagues compared Tai Chi to standard physiotherapy for knee osteoarthritis. For knees that were already technically bone on bone, Tai Chi did not just match physiotherapy on pain and function. It improved depression and quality of life more. The same knee, the same scan, different practice, different result. So what do you actually do with this? Let me give you 4 things to take into the rest of your week. 1. When you read your scan report, read it like a weather report, not a verdict. It describes the structure of your tissues at that moment. It does not describe your future. It does not describe what you can or cannot do. A weather report says rain today. It does not say give up on your weekend. 2. Ask one question of any practitioner who shows you a scan. How common is this finding in pain-free people my age? If they don't know that information, the science says incredibly common. By age 50, it would be unusual not to have something on a scan. If your practitioner cannot put your scan in the context of pain-free populations, find one who can. 3. Move. The single most powerful intervention for knee osteoarthritis, low back pain, and most degenerative findings is movement. A 2023 network meta-analysis of 217 randomized trials published in the Orthopedic Journal of Sports Medicine found aerobic exercise, walking, cycling, swimming, was the most effective treatment for knee osteoarthritis pain. The Danish GLA-DADAD program shows that an 8-week education and exercise program improves walking ability in 51% of people with moderate to severe arthritis at 3 months and 58% at 12 months. Movement is not the enemy, stillness is. 4. Practice something old. Tai Chi, Qigong, Yoga, even a slow mindful walk in the morning. These are training systems that teach your nervous system that movement is safe again. They rebuild trust between you and your body, trust that the scan tried to take away. 8 weeks of consistent practice, 15 minutes a day. That is enough to change the conversation between your brain and your knee, between your brain and your back. Here's what I want you to leave with today. Your body is not a damaged machine. Your scan is not your sentence. The story you have been told, bone on bone, severe degeneration, you'll just have to live with it. That story has more to do with the language of imaging than with the truth of your body. The evidence is clear. Most abnormalities are common. Most pain is multidimensional. Most people get better with movement, education, and time. And most of all, the words you tell yourself about your body matter more than the picture on the screen. If this episode shifted something for you, send it to someone who needs it. Someone who's been told bone on bone and gone home and stopped moving. Tell them the truth. Their body is still capable. Their body is still listening. This is the Wellness Bridge. I'm Gary Chen. Remember, together we find balance in one.